this Gurdeep Shraw's second question is
Yes.
how to differentiate between a regular sore throat infection and a COVID-19 infection and uneasiness?
Sure. So as I told you in the beginning, the differences between seasonal flu and COVID. Number one, please remember when a pandemic is on, the regular flu is almost non-existent for 2 or 3 reasons. One is that last year we hardly saw any seasonal flu. Hardly any seasonal. Think of a patient who had the regular flu last year. They're few and far beyond. Children are not going to schools. The restaurants are largely shut, so there's not much of dining out. So viral gastroenteritis is down. Viral infections spread between children a lot. So one of the reasons why seasonal flu is low. So right now, symptoms of flu is COVID until proven otherwise. Having said that, if your swab is negative and your recovery is within 4 to 5 days, swab negative recovery within 4 to 5 days, I think I would still probably isolate just in case it was a false negative. And loss of smell, loss of taste, not going to be there. The terrible sore throat that you get, with COVID is not usually seen in seasonal flu. And so seen seasonal flu or patients complaining about it. We're giving them the seasonal flu vaccine. So it's very interesting because we, from our clinic, give the seasonal flu vaccine every year to our elderly patients with chronic lung disease. And they're still coming in and they think I've got the COVID vaccine with me in my clinic as well, which unfortunately I don't have the privilege like the Apollo group to have it, but hopefully our hospitals will soon have it. But I think those patients are already sensitized to flu vaccination. And I hope they will be sensitized to COVID vaccination as well, because a lot of our elderly are still not vaccinated, and so we need to increase that tempo.
A word for them, there are people who have all sorts of reasons. One is some people have a reason that they don't like the certificate and some photograph on the certificate that is there. They don't appreciate that. Or, they're just worried about whether the vaccination will be effective or not.
Yeah. There's one message here. The vaccine is effective, whichever vaccine you take. If you're worried about the certificate or the photograph, you don't need to look at it. That's my simple message. You can just get on with your life. I think you need the certificate. I think that's a very silly reason to not want to take the vaccine, Pradyuman. We need to take the vaccine. I have had at least 2 consults online a day, and I do probably about, 4 or 5, and sometimes I just get so exhausted with the hospital work, I can't even do those. But every day there are 2 or 3 people who've had the vaccine who have got COVID. I think only 1 in the last 2 months reached the hospital, which is a story in itself. So vaccines prevent you from getting severe COVID and hospitalizations. That's one message that needs to go across. Everyone should take the vaccine. Which vaccine? I would recommend any of them, but there are certain patients where we would probably avoid Covishield, for instance, where you have a history of thrombosis or clots. I think there I would probably towards Covaxin. Also children, the younger group, not children actually, the 18 to 35 group, there is no data on any side effects actually. There's hardly any side effects yet, though the numbers vaccinated are much less. So let's be fair to Covishield and Covaxin here. Covishield has many more vaccinated world over with a small amount of clots, negligible. If you ask me, the benefit of the vaccine far outweighs that risk. Covaxin has got no demonstration of clots, but has less number of people vaccinated. So probably for the younger group, Covaxin, but I wouldn't be steadfast about that. The Russian vaccine Sputnik is equally good. Also a replication deficient virus. So like Covishield, adenovector virus. There was a report again from Brazil that, I don't know if you read that, Pradyuman, that they rejected the Russian because it was replication competent. That was one batch. The problem is one swallow doesn't make a summer. So one batch It gets international headlines for the quality of one batch that was slightly bad. But I understand in these times, there is just one suspicion that just makes people hesitant to get vaccinated. But I think all three vaccines are good. Whichever one you get, take it.